All right, we're going to go ahead and get started. And as people trickle in, I'm sure you will join in time for the presentations. So welcome everyone. Thank you so much for joining us. This is the second webinar in our series on the I'm Here approach. And if you attended our first webinar, you will know a bit about why we are doing this series. But if you did not join our first webinar, let me just re-explain why this series is being hosted. We wanted to share the I'm Here approach and lessons learned from implementation with the wider humanitarian community. And we hope that through this webinar series that we can share with you how we might use various tools and pieces of the I'm Here approach to better reach adolescents who are affected by crises or displacement. And so, as I said, this is the second in the series. The first webinar looked at or gave an introduction to the I'm Here approach, an overview of the tools and why it is used. And we also heard from colleagues who have informed the I'm Here approach through their work with Girl Sparks and with Pop Council. And you can watch that webinar, the recording, on our website, and I will share out that link soon. For the second webinar, we are going to be hearing from organizations who have actually implemented the I'm Here approach in the field, and we want to hear from them to understand practically how does it work, how is the I'm Here approach used in a practical way, and also some lessons learned, challenges, and how the I'm Here approach can be adapted for various settings. So we are joined by two colleagues from Mercy Corps. Our first panelist is Amy Eibold, who is the Senior Advisor for Adolescent Girls and Youth, working at Mercy Corps headquarters. Amy has 15 years of experience working on initiatives that reach adolescents and young people with a focus on gender equality. And she has been supporting global implementation of the I'm Here approach in her role at Mercy Corps for 7 years. Our second panelist is also from Mercy Corps. It is Andrew Agbenyi. He is the Senior Monitoring, Evaluation, and Learning Officer for Mercy Corps' Building Resilience in Complex Crisis program in Northeast Nigeria. Andrew is a community development professional with more than 7 years of experience in monitoring and evaluation. He's worked with different organizations in Nigeria in both humanitarian and development contexts. Next, we have Sarah Schreff. She is the Child Protection GBV Specialist with DRC Lebanon. Sarah has worked with DRC since 2016 and has been leading the Empowering Adolescents program. And joining us for the discussion portion of our webinar is Robert Momini. Robert has been working in South Sudan with IOM since 2017 and has experience in multiple camp settings. He has a background in displacement tracking, monitoring, and evaluation. And he worked alongside the camp coordination and management team in WOW IDP camp to implement the I'm Here project in 2019. So welcome to all our wonderful panelists and to all of our participants. We encourage people to use the chat, as I see people are doing, to introduce yourselves, what organization you're with, where you are. It's a great way to connect throughout the webinar. And we also encourage you to submit questions through the Q&A feature. We will have hopefully 15 or 20 minutes at the end for a moderated discussion. So really appreciate or would recommend using the Q&A feature if you have any questions at all for the panelists. So with that, I will hand it over to Amy, who's going to kick us off, and over to you.
Thank you, and hi everyone. I'm happy to be here and share a little bit about how Mercy Corps has partnered with WRC, and I'm going to share my screen in just a minute here. Okay. So quickly, I wanted to just share Mercy Corps' vision for our humanitarian response globally. And About 5 years ago, we focused on the unique needs and capacities of adolescents, and we just wanted to make sure that we were reaching them and understanding their needs. And we really believe that if we can find and reach and integrate adolescents into our response, that not only can we accelerate recovery and build resilience and strengthen local capacity, but we can change the trajectory of these adolescents' lives. So as a part of our commitment to adolescents, we partnered with WRC in 2015. So for the past 5 years, we've been piloting the I'm Here approach. And we have piloted the approach in Iraq, Turkey, Syria, Jordan, Yemen, Nigeria, Mali, Guatemala, and Haiti. And you see here, this is a photo from Gaziantep, Turkey, where it's one of the first places where we used the I'm Here approach. I wanted to start with just a little bit about how we institutionalized the approach. And I sit on the Young People in Protection team, and we collaborated with our humanitarian leadership and response team. And we invited WRC to host a workshop at HQ, and we started to talk about the approach and how it might be implemented globally. We invited team members from several different countries to Portland, where we're based, to learn more about the approach and how it might be used globally. And then here I say AIE, it's Adolescents and Emergencies. So we then held a global workshop for all of our teams across Africa to, again, not only talk about the I'm Here approach, but how we might better reach adolescents, understand their needs, and build on their capacities in different humanitarian crises. From that, both of those workshops, we invited global teams to submit concepts and how they might pilot the I'm Here approach. And that was funded privately. And from those pilots, we documented learning, we looked at adaptations, and then we shared those out, again, sharing those globally and testing different adaptations, which I will talk about today. And then from there, once we had documented what worked and where the challenges were, we started to include the I'm Here approach in different proposals and concepts when responding to humanitarian crises. And we've also integrated it into a global field guide, an Adolescents and Emergencies guide. And we are currently developing 6 webinars and workshops that take our global team members through the field guide and understanding how to reach adolescents, including how to use the I'm Here approach. So since 2015, Mercy Corps has been involved in different learnings. I'll share some of the challenges and adaptations with you today. So in 2015, we were in Gaziantep, and one of the learnings there was that this was really youth-led. We collaborated with host country nationals, young people, as well as refugees to lead some of the field work. And out of that work, we created a contact list for targeted outreach. So when we went door to door, we asked for contact information and followed up to invite young people to the focus group discussions. I'll talk a little bit about what this looked like in terms of the girl roster and sorting it by nationality to better highlight vulnerabilities. Later that year, working in Iraq and Yemen, we were able to create and pilot the Boy Matrix. And so that allowed us to not only look at the vulnerabilities and capacities and needs of adolescent girls, but of course to better reach boys, which is very important. In Mali in 2017, we started to test and look at real-time monitoring. And so being able to understand what was happening on the ground at the moment with adolescents we were working with. In Lebanon, 2016, we learned that it's just absolutely critical to have a protection focal point in the field. I'll talk a little bit about that and what that looks like. And then globally, we've been adapting the PRM, or the the ranking method, where adolescents talk about what they need. We found that It could be confusing, and we've created an adolescent consultation tool, and I'll talk a little bit about that. So looking at our work in Turkey, we went door to door using the Girl roster, and we reached 1,317 households. And just an important learning here was to make sure that teams are going door to door and making sure that we mark that, even if there's no answer. And you'll see here that about 42.8% were willing to answer the questions and give us information. 20% declined participation. We've learned that, there is absolutely fatigue around giving information, especially during a crisis when we have a lot of peer agencies on the ground trying to understand what's happening. But this is what the Grow roster looks like. So door to door, the different data. But what you don't see is that there's different vulnerabilities between Syrian and Turkish girls. And so this was one of the new outputs through our initial piloting of the tool. So you can see here, the Grow roster looks at the vulnerabilities of adolescent girls, which is defined by whether or not they're out of school, if they're living with a parent or not, if they're married, and if they have a child. And those vulnerabilities were identified by Pop Council. And if you look here, you can see that there's different vulnerabilities between Turkish and Syrian girls if we start to break it out by nationality. And if you can just, I'll allow you to take a look. If you look at just the Syrian girls, you'll see that 19 are living with just one or neither parent. And if you look at the host community among Turkish girls, all of the girls were living with a parent. You'll also see that among the Syrian girls, if you look at the 15 to 17-year-old age group, we learned that 5 of those girls have a child. And again, looking at the Turkish girls, none of those girls between 15 and 17 had children. So a key output here was just understanding that we should disaggregate by nationality, and understand that refugees were facing different vulnerabilities as their host community counterparts, and how we might meet those needs. I just highlighted some of these differences, but just understanding again that Syrian girls accounted for 96% of those who were out of school, while they made up half of the girls who were in school. And then we were also able to highlight again that there were a number of adolescent girls who were married or engaged. And 15 of those girls, they were Syrian out of 16. So there was only one Turkish girl who was married. So we're, again, highlighting different needs of girls depending on who they are and where they come from. And again, none of the married girls were currently attending school. And so that shaped our outreach. Mercy Corps operated a community learning center, and we were able to better understand the girls' needs, and especially the married girls who were talking about what they wanted to learn, particularly because they were out of school, and again, what their availability was to join some of our programming. The second output, or adaptation, that we collaborated with WRC on was the boy matrix. So again, the I'm Here approach was first focused on the needs of adolescent girls who we know are incredibly marginalized during an emergency, but we also want to take a holistic approach to those who we're reaching. And so we piloted the boy matrix in a handful of countries, including Yemen. And what you'll notice here is that boys face different vulnerabilities than girls. And so where we started was trying to understand if boys were in or out of school, if they were working, and if they lived with a parent. And since we did this work, our teams have come to us and said that being a parent for a boy is also vulnerability. Of course, that's different because boys are not pregnant or giving birth, but we do understand that that might place them in a different vulnerability category or need different things. And so again, if you just compare, the girl roster is at the bottom and the boy matrix is at the top. And you'll see that, again, it's allowing us to differentiate what adolescents need during a crisis. And so if you just take a look, you'll see that among the boy matrix, 218 boys are living with both parents, and only 11 boys live with neither parent. Whereas if you look at the girls we reached, you have 33 girls who are living with neither parent and 68 who are living with just one parent. I'm going to hop ahead here. So again, we were able to look at significant differences between the profiles of boys and girls and then program accordingly. So if you see here, like we found out that 42% of adolescent girls were out of school, while 87% of adolescent boys were in school. So that speaks to how we might be able to reach adolescents and the different type of support they might need. 21% of adolescent boys were neither working or in school. And of course, we consider that a very high risk category when boys are, they have nothing to do and they're left alone. And then you'll see that 8% of boys were just working and out of school. So again, the boy matrix allowed us to look at different vulnerabilities, capacities, and better tailor our programming approach. Another key learning coming out of our collaboration was that it's absolutely critical to address protection issues. And what you'll see here is also taken from Yemen. And it was a focus group with girls, 10 to 12, following the contact list that we generated from the girl roster. And while the methodology does not ask sensitive questions, it does not ask about gender-based violence, girls began sharing experiences with gender-based violence. And so let me stop here. So a few things that Mercy Corps learned is, one, anytime we have someone running a focus group discussion or the ranking methodology, is that they need to be trained in very basic psychosocial first aid, that they need to understand how to ensure that girls feel safe and to handle those disclosures through referral mechanisms. And I also wanted to share an experience from Lebanon in which we were doing the girl roster and going door to door. And what we found was a surprise, and that is that we met a lot of girls from Bangladesh who answered the door, who were under 18, and who were working as in domestic labor. So it was something that we were not expecting, but also how do we handle those discoveries, if you will, when we're coming across girls who are unaccompanied or who are being kept by a family. So we've placed protection focal points in the field. And so when our teams are going door to door, they can contact a focal point who understands in the local community where those referrals can be made and who they can reach out to. And then another adaptation we've made is moving from the ranking methodology to adolescent consultations. So this is an example following the girl roster or boy matrix. We invite adolescents to a focus group in which we ask them to rank their primary needs. And so you'll see here, it gives us some information to work on, but we decided we wanted more in-depth information. So just here, following up on Yemen, we saw girls, education. And again, you saw most girls are out of school. So education was a high priority for these girls. Water presented risks when they were collecting water in terms of exposure to violence or taking time to collect water. I'm going to jump here and talk a little bit about how we've evolved this tool. So what we decided to do is adolescent consultations, and this takes a note from the Population Council and their asset building exercise. We also wanted to make sure that we weren't just extracting data from adolescents, but that the experience itself was enriching and empowering, just knowing that this might be the only point of contact that we have with these adolescents. So this is a consultation that we did in Colombia as part of our response in Venezuela. And in talking to migrant girls, we took them through a consultation in which they were able to draw a girl that is representative of someone in their community. And they were able to connect with other girls. They interviewed each other, they shared their hopes and dreams. And then we kind of moved into trying to understand what their needs are. You know, their basic needs were unmet. Many of the girls had nowhere to sleep. And they also had, no money. Adolescents faced incredible protection risks. They talked about not having ID or being forced to return. And then again, gender-based and sexual violence. And then the third finding is, that they're working alongside their mothers or working alone. But what we also did after having the girls draw someone in their community and relate to who that girl was is we used the asset building cards that were discussed in the first webinar to have girls identify their priority needs and skills and knowledge they wanted to build, working through that asset building strategy or approach in order to, again, shape our programming and making sure that girls have a say in how we program and what they need. So just some brief reflections, and I know we'll have time for questions later, but yes, there are always limitations to this approach, and that we need to be very cognizant of the context we're working in and how we might adapt. And very important is that the I'm Here approach is not a research tool. And it's very important that we connect it to programming, or it doesn't have the impact that I think it was designed for. Again, because it's not a research tool, it's not just about numbers and households reached, but really understanding the profile, the adolescent profile of a community. We are working with our teams on a checklist to really understand whether or not the benefits outweigh the risks when conducting the approach, and also if it's possible to gather this information in another way. And then finally, and circling back to understanding that this is not a research tool, is that this information gathered should really inform programming and benefit the participants who were involving. So with that, I am really happy to hand it over to my colleague, Andrew, who is based in Northeast Nigeria, to talk about how Mercy Corps implemented this approach to inform programming there. Thank you.
Thank you, Amy. That was so wonderful to hear about how Mercy Corps has adapted the approach in creative ways that respond to all of the different contexts. I learned a lot, so thank you. And yes, now over to Andrew to share in a bit more depth about the experience piloting or implementing the I'm Here in Northeast Nigeria. I'm going to go ahead and share my screen for you, Andrew.
All right, thank you, Julia and Amy. I've worked with Amy for over quite a number of years, and we work remotely to actually set up an EU-funded program in Nigeria, here to be precise, in Northeast. So we were able to implement we were able to implement investing in the safety and integrity of Nigerian girls program called ISING. The goal of the project was to improve the safety, livelihoods, and personal agency of these adolescent girls and boys in Northeast Nigeria. And we were able to work with 12,000 adolescent girls and 5,000 adolescent boys with life skills, reproductive health, psychosocial supports. financial literacy and job readiness, and livelihood trainings that was delivered through Safe Spaces. So it was an EU-funded program, which was from 2016 to January 2019. So I'll really be building on Amy's presentation, the traditional I am here approach that talks about identifying, um, engaging, as well as empowering adolescents. So we did some little modification to the approach. So what we started with for the ISING program, we started with a kind of exploratory visits where we went to the communities we want to implement the program. So we did that to actually understand the lay of the lands. We now proceeded to do like the service area mapping, which we did that to actually understand the services within those communities, as well as those resources that will be responsive to the need of these adolescents within again, due to understanding and how different programs have actually implemented in these communities we actually wanted implementing, since it was not just a core cash kind of program, we understand there were going to be some level of not accepting the program within the community. So we adapted and developed a model called the bridge model. So bridge model is simply just an analogy that deals with stakeholders trying to understand um, the hurdles and challenges an adolescent within a community could face in realizing his or her dream. So again, it was a participatory approach where these major stakeholders within the communities actually saw the need that the program will really benefit their communities. So with that, we went ahead to do mapping of these adolescents, where we mapped out the we did the mapping of these adolescents within the communities. So on the mapping tool, we still made some adaptation to the tool where we looked at the demography, we looked at the assets, we looked at schooling status, and also looked at the livelihoods. So again, the analysis of this data after collection of those information from the adolescents was what we actually used to inform our design. So for example, on the demography, looked at resident status that talks about whether the person, the youth or the adolescent is an IDP, is from the host community or it's a returnee. We also looked at marital status for those that are married and for those that are also single, as well as looking at the assets that they have within those communities. So again, we also looked at the schooling status for those that are in school, for those that are not in school, as well as the livelihoods they've actually engaged themselves in within those communities. The analysis was actually what we used to shape the implementation of the program in NS, just like Amy actually highlighted using the girl roster and the boy metrics. So for example, the analysis, we use what we call age disaggregated data to really um, design the needs of these specific age adolescents within those communities. We also looked at the schooling status, for example, those who are in school. We realized that safe spaces for them would not really work in the morning time as well. So we looked at options that was actually feasible for them. So we worked with the data to shape their timing as regarding when the safe space sections were going to be holding. Again, we also looked at those livelihood opportunities that they've actually worked on before. And again, this is also some of the opportunities we had to really redesign our intervention to really meet those needs. So again, we proceeded with the empowerment, which has to do with the safe spaces. So the challenges we had while trying to implement this ISING program within those communities was the fact that we were actually not really being accepted within those communities. And again, that's why we actually had to come back to the drawing board and we developed that bridge model. Also, for us to really being able to map out the most vulnerable within those communities, it was really difficult. So as such, we had to use a kind of small snowball approach. For those that actually understand the context in Northeast Nigeria here, it is very sensitive in terms of cultures and religion to a greater extent, where um, people can really not have access to certain kind of household. As such, we use some of those girls who are in those households to actually get across to other girls. Then again, it was really difficult getting safe spaces, even though at the end we were able to get some of those safe spaces with the use of a kind of tool called the participatory ranking tool. So again, it took a whole lot of time with all of this. So these were some of the challenges we had in implementing the I am here approach using those methods. So some of the key findings we had, we realized from the service area mapping that some of the services identified or the sources or the facilities or the centers identified were not really responsive to the needs of these adolescents. For example, we looked at the health facilities within these communities and we realized that there were no sessions that actually meet the needs of adolescents. As such, we collaborated with other organizations that could support in that regards. Then again, the girl roster and boy metrics, we were able to make visible the profile of these adolescent girls and boys to actually tailor intervention to best meet the need. Then again, before we fully adapted the curriculum that we use for the safe spaces, we held several focus group discussions, not just with the adolescents, but also with the parents of these adolescents. So the essence was for us to actually listen to them, to actually understand what their fears are and what we need to modify in terms of the curriculum that we are going to use. So again, we're able to understand, and these adolescents were able to express their need for us to actually look into the areas of leadership skills and confidence in order for them to make decisions about their lives and family. So we realized that during the safe spaces, girls were able to connect with each other very well. There was this social cohesion, and for those who are survivors of SGBV, they started breaking away from that stigma within the communities and were able to mingle freely with other peers, other adolescents within the safe spaces. So also we realized that safe spaces approach for adolescents was really a successful learning experience because this also helped to integrate and support each other in terms of when they come to those safe spaces, a place where they could really express themselves, air their views, and actually connect with each other. Also, we were able to walk through identifying local mentors within those communities. So we worked with the mentors and coordinators because we were actually thinking on how um, we could leverage on the structures within the communities where these adolescents actually look at girls and boys within those communities that are actually a model to them. So we worked with them, developed a kind of a guiding document that actually we used to to get those mentors within those communities, and they serve as those that were actually supporting and facilitating those safe spaces within those communities. And even as I speak now, these mentors and coordinators, they remain key resources in those communities that we've worked in. So thank you. Over to you, Julian and Amy. Sarah.
Thank you so much, Andrew. And it was great to have that presentation following on to Amy's to see how the approaches that she discussed that have been used by Mercy Corps were applied in the context of Northeast Nigeria. In particular, it's great to hear about your community engagement because that is a piece of the I'm Here approach that might be missing or not there that we hope to build out further. So would be great to hear more about that during the discussion time. So I will now introduce our third panelist, Sarah, who is, as I said, the Child Protection GBV Specialist with DRC in Lebanon, and she will be presenting on the experience of the country office in utilizing the I'm Here approach. I will now share my screen again for you, Sarah. One moment here, bear with me.
Sure, thank you.
And there you go, over to you.
Thank you. Can you go to the next slide, please? Hello, everyone. This is Sarah again from the RC Lebanon. Similar to my colleagues who introduced the program, we also did we are implementing the I'm Here approach in Lebanon. I will walk you through the PowerPoint presentation to tell you more about our experience. But before starting, I would like to tell you a bit about the Lebanese context. So Lebanon is the largest per capita refugees hosting country. We have around 1.5 million refugees who live in Lebanon. 78% of refugees in Lebanon lack any legal residency documentation, which of course puts children at greater risks. Lack of civil documentation also impacts on all areas of life, such as going to school, finding a decent job, maybe registering their marriage as well. As for the child marriage, 28% of all refugees, girls aged between 14 and 18 are married as per 2019 statistics. As for the child labor, also as per the 2019 statistics, we have more than 100,000 child who are engaged in child labor. And 68% of GBV cases in 2019 are related to IPV. Why I said in 2019, because I'm sure that in 2020, the number will increase, especially after COVID, because only last month we had an increase of 6% in early marriage and of 7% in child labor only last month. Can you go please for the next slide? Thank you. So the DRC Empowering Adolescent Program, or EAP, is formally known, it's a long title, I'm Here, I'm Stronger, Empowering Adolescent Girls and Boys at Risk of Early Marriage and or Child Labor and Strengthening Their Protective Environment. So from the title, we can know that this is an innovative and integrated SGBV child protection, and recently we included some livelihood component in it. Next slide, please, Runian. Yeah. So as an overview, we have now the roadmap. As an overview of the roadmap, we will go into the steps later in the other slides. So this roadmap tells us a bit on how the approach works. As you can see, that in the center, we have the adolescent girls and boys at risk of early marriage and the girls and boys at risk of child labor. They are in the center of our approach. The first step is the door-to-door assessment and outreach methodology. After the identification, as you see, we also engage adolescent girls, similar to my colleagues, to check their interest and their preference and their needs, of course. We didn't invent any curriculum because we have a treasure of curriculum in Lebanon. So we didn't need much to put a lot of effort in developing curriculums. As you can see, also we developed a curriculum to engage their male caregivers and their female caregivers, as well their adolescent boys, such as maybe their brothers or sometimes the husbands of the adolescent girls. For eligible cases, of course, the RC will provide case management because this is the cornerstone of our work. As you can see in some of the steps on our right, on the right side, the RC has integrated some livelihood services or economic recovery services as part of the integrated model. Today, I'll be talking in brief about it because we are still piloting them. And of course, we can report to it in the future. But for example, it can include the use of transitional cash. This is a term that we are using now to describe cash assistance to household in which there is a child engaged in child labor. We have also intervention with employers through raising the awareness on decent work conditions, the risks of child labor, the right of the children, and we are trying to encourage them to develop alternative business model to rely less on child labor. We also, of course, trying to have a livelihood intervention with the caregivers and with the adolescent girls or boys who are above 16 years old, because as per the law, we cannot, they cannot work below 16, of course, through a skills building exercise and vocational training. Now back to the approach itself. The refined integrated adolescent girls program was developed, adolescent program was developed in 2019 with consultation with the RC Protection and the Economic Recovery Frontline Workers, local partner staff, because they've been using it, they have been using the Adolescent Girls program since 2014, our partner. And of course, other components such as the I'm Here approach were developed previously, but it was combined as part of this approach back in 2019. So the I'm Here approach was originally, of course, designed by the Women Refugee Commissions and adapted by the RC to the Lebanese context since 2014. To support targeting of the most invisible and the marginalized adolescent girls. And since then, the RC in partnership with WRC has further contextualized and developed the approach, aiming to prevent and respond to in Lebanon. So in 2019, we had an addition. We adapted the I'm Here approach, the I'm Stronger, to also focus on child labor. The approach has been adapted and further developed to prevent and respond to child labor, as well as early marriage, because it's very, very rare that we can find a household with one vulnerability, such as early marriage. They always have both most of the time, along, of course, with other vulnerabilities. Next slide, please. So the main pillars, I think they were mentioned in the first webinar. I won't go in depth into this, but I will tell you more about our experience in using these three pillars. So the first pillar is find them, of course. We used a tailored, simple door-to-door outreach and assessment methodology using COBO. We find neighborhood, we choose a neighborhood, of course, based on many criteria, and then we go to each and every door in this neighborhood, and we try to target all the households there, to, of course, to be able to reach both invisible girls or boys who are at risk of early marriage or child labor. The outreach, of course, is complemented with the service mapping exercise. Sometimes we use the Track My Trip application, and sometimes it's a simple application that can be found on any phone. And sometimes we are using a simple mapping, like a simple map that we can draw with the adolescent girls, and we do the mapping together. So through this, we try to also to engage potential service provider, so they can later come to the sessions that we develop with the girl and they can give different topics around legal, maybe sometimes women entrepreneurs, and so on. The second pillar, sorry, it's the listen to them, of course. Also similar to our colleagues from IMC, it's the building asset exercise, as I mentioned before, where the adolescent girls or boys try to find, like, to match their needs and interest, and we directly collect their feedback to come up with a curriculum. The third pillar is to design with them, of course, using the finding from our service mapping, as well as the building assets exercise to design a curriculum specific to each group, based on, of course, on the available curriculum in Lebanon, which are, and even not only in Lebanon, we use a lot of other curriculums that are developed by other organizations, such as IRC. This will help, of course, and help the facilitator to build a tailored curriculum that equip adolescents with practical assets and the following broad categories, such as human health assets, social assets, economic assets, and cognitive assets. And sometimes in one area, we used to have different, like maybe four, five groups, and each group, they have different curriculum because the needs are different and the interests are different from each group to the other. But in some, like, we have four recommended sessions that we always recommend to include them in the curriculum, which are the community reflection exercise, where they are able to identify the most vulnerable girls, such as the girls with disability, because they are always invisible, and maybe sometimes their parents don't send them to such activities because of stigma and many other reasons. And also we do the safety and risk mitigation. And as well as we shared, one of the recommended session is to share comprehensive service mapping, where we invite healthcare or legal professional to share information and raise awareness on key issues such as legal documentation, marriage registration, birth registration, and so on. We also recommend to a field visit to key services delivery centers, especially for married girls, such as healthcare centers. And of course, we always recommend as well to have an open door event at the beginning of each cycle, where we can introduce to the parents, to the male caregivers, and to the female caregivers our program, to where they are sending their children, which creates some kind of confidence in the organization. And at the end, we also have a graduation of an event for each cycle for the adolescent girls or the boys who are engaged in child labor. The I'm Stronger approach. I will talk now about the I'm Stronger approach and what we did recently for in the I'm Stronger approach. So we have a tailored curriculum to engage female caregivers of adolescent girls and boys at risk of and engaged in child labor and or early marriage, of course. We also have, I will talk about this curriculum later in the other slides. We also have the same tailored curriculum to engage male caregivers. And we use Program Law, which is a curriculum designed and developed by a local NGO called Abad, to use it with the adolescent boys, maybe the brothers and other family members of the adolescent girls. So engaging the female caregivers, the curriculum address female caregivers first as individual with their own emotional needs, supporting them to deal with the stressors in their environment, all of which have a direct impact on their caregiving, of course. Then it addresses essential issues around parenting, gender equality, prevention and response to early marriage and child labor. It depends on the needs that they have. As I said at the beginning, that Each household is different, and sometimes they have both vulnerabilities. So the facilitator can choose 2 topics of the elective modules based on the results of the focus group discussion that we have in the first session with the caregivers. And then if you go to the engaging male caregivers, engaging male caregivers, it's like we tried to transforming their thinking towards masculinity and paternity in the curriculum. It also addresses some of their needs, not only what that they can do to reduce the risk of child labor or early marriage, but also to address their needs as male caregivers. And this is it makes it more appealing for them to participate as individual, because we put their needs as well, not only like what they can do to prevent this, because some like we know, like since 2011, since the beginning of the crisis, there is some kind of fatigue at the like in the community level of of the issues that is raised, such as early marriage and child labor. And the engaging male caregivers, it can be also, it's a cycle of 8 modules only, but it can be extended up to 12 upon the caregivers availability, because most of the time the male caregivers are available in specific time after work, and they work till late night and so on. As for the integration, as I mentioned earlier, as for the integration and with the ECREC or with the livelihood, as mentioned earlier, in 2019, we expanded the approach to also include some linkages with the DRC ECREC department, because anyway, as DRC, we offer livelihood services as well as protection services. We thought it will be good to explore potential linkages that could better facilitate access to services for beneficiaries. And based on our conversation with the protection sector, we know that one of the biggest gaps is often the lack of livelihood services for both caregivers and adolescents. So we try to engage with the employer when relevant, through business development training and decent work sensitization to raise awareness on the risks of child labor and, as I said before, the rights for children. And also we are trying to do market-driven livelihood activities, vocational and other skills training for children above 16 years old, as well as caregivers, to reduce dependence on child labor. And not to use the child labor or early marriage as a negative coping mechanism. And finally, the transitional cash assistance for the most vulnerable families to support transitioning out of child labor and other negative coping mechanisms. As for our experience, I will talk in brief about it, and then we can discuss it more in the Q&A session. So until 2000, and we used to engage male caregivers and female caregivers for child labor, but now, as for child marriage, sorry, but now we are engaging them to target both vulnerabilities. So we worked on both curriculum. And of course, we are trying to engage with employers when relevant and when possible, of course. And also from our field observation, there was a lot of the beneficiaries that they were asking of livelihood activities, as well as transitional cash, of course. And to include graduation event at the end of each cycle for the adolescent girls, as well for men when possible. This will give them a sense of belonging, or like they own this because they tailor the curriculum themselves. And of course, to always include field visits when possible for SRH services, lawyers, and women entrepreneurs. And also we used to give before cash for rent. It was a cash for rent. And then we discovered that it's better to give or to try to give unconditional cash. Um, and not to mention, of course, whenever we used to go to the field and to mention the early marriage in front of the caregivers or are giving session around early marriage, they were thinking that we are the cause of their daughters that they are not getting married. So it's very, very important to invite them for an introductory sessions along with their caregivers to present the program and its benefit and so on. So this is it for now. Thank you. Um, yeah. Thank you, everyone.
Thank you so much, Sarah, for sharing the experience of DRC Lebanon. I attended or participated in another webinar with you where you shared the experience, but I learned even more today. So that was really great. We had hoped to hear from our colleague from IOM, but he has internet challenges being in a field location in South Sudan. So unfortunately, he got kicked off the Zoom webinar and is unable to rejoin. So I think I will just head into the discussion portion. Please, I urge participants who are still with us to submit any questions. Either you can use the chat or the Q&A, or you can raise your hand if you want to ask the question not in writing, and I can unmute you so that you can ask the question. But I do have a question to start that I wanted to pose to all panelists. If you are able to turn on your video, could be good to see everyone again. Thank you. So one thing I noted through your presentations was the importance of community engagement and also reaching parents and caregivers and other key people that are involved in adolescents' lives. And I think this speaks to how adolescents are not just in a vacuum or in a silo, and the need to really engage with other key actors who might have influence or decision-making power in the adolescent girl's life. So I would be curious to hear from you all. Who do you think are the most essential gatekeepers in the life of adolescents? And from those, I guess, what are the challenges to engaging them? And what are some best practices that you've noted in engaging these people in programming? Whoever wants to start, maybe Andrew, we can start with you. So yeah, who have you noted in the context of Northeast Nigeria are the most important gatekeepers, if you will, or influencing factors on adolescent girls' lives? What have been the challenges in involving them in programming, or what are some best practices to do so?
Thank you for that question. But again, let me just point out categorically that all the stakeholders are very, very important, most especially even the adolescents themselves. With them not really consenting to participating in the program will really be a huge failure for the program. Again, their parents, the community leaders, and all those that forms part of the community structures within wherever you are working. Yeah, it depends, and it is context specific. What might be applicable in Northeast Nigeria might not be applicable in other parts of the country, and also maybe in other regions of the world. So, however, I think the most critical point is the adolescents themselves for me. And again, for this context, I use Adaptations program as an example. They were really underage. Looking at the laws within the country. So at that point, we actually needed someone to really consent for them. So it was more of like the parents really consenting or assenting on their behalf to really participate in the program. So for programming for adolescents, we really need to take cognizance of national policies, national laws to ensure that we are not breaching all of that. Yeah.
Oh, my dog is barking. I'm so sorry. Challenges of working from home. So Sarah, maybe you can go next.
Yeah, and you might listen to my son's voice in the background. So sorry from now because it's his bedtime, and of course, he will come to say good night. Yeah. So as I said, it's very, very important to include all of the decision makers in the girl's life, such as male caregivers, female caregivers, sometimes their brothers, sometimes their mother-in-law. So it's very important to do that, because most of the girls or most of the children who are engaged in both, they don't have control over their lives, and they don't take the decision in anything, like whether to be in, like most of them, to be in child labor or to get married. And even the girls who take the decision to get married, it's not an informed decision, you know. So it's like it's of course it's they are influenced by their sisters, maybe their cousins, and so on. So it's very important to engage everyone in the girl's life who can take decision.
Thank you. So maybe in my next question, I'll have Amy answer first. I know we've discussed this previously, and it relates to evidence that the I'm Here approach is can be successful and meaningfully engage adolescents. And so my question is that, you know, we have some anecdotal evidence that the I'm Here approach is effective in reaching more marginalized adolescents. But it would be great to hear more from your perspective on what additional evidence do you think would be important to gather to ensure that the I'm Here approach is effective and is also making an impact on reaching adolescents in different contexts?
I think that's such a great question, and it's a question that we've been trying to work through with our global teams. And I had mentioned earlier, I think it's really important to remember that this is not a research tool, but a programming tool, because otherwise it really has very little impact. But we are looking for ways to ensure that if we understand the differentiated needs of this group of young people, that we can respond and be more responsive to their needs and also build on their capacities. But how do you measure that in terms of whether or not we've used the I'm Here approach? And so I think that as practitioners, we know that understanding who we're working with will have more impact, but being able to link that back to using the I'm Here approach is still a big question mark. And I would put it to my fellow panelists on ideas in terms of trying to understand what the impact is, or how can we document when we use the I'm Here approach? Can we really link it or make connections to more impactful or positive programming? I do, and will venture to say that the program that Andrew worked on in Northeast Nigeria, we had really incredible outcomes, and we documented that and impact with the boys and girls that we worked with. And we also know that we use the I'm Here approach, but then how do we tie that together? And how do we know? Is it just about tailoring programming and better understanding? And then I would just quickly add that it's, in some ways, this is a hard question to answer, because we're not able to compare, like within a program where we use the I'm Here approach in one community but not the other, and then trying to compare outcomes is difficult. But I do think that that's a big question mark in understanding, is this a valuable approach in terms of actual programming impact?
Yes, and Sarah, I believe you had shared previously that you did do some assessments to see how the I'm Here approach was useful in different areas of programming. Am I right in remembering that? And if so, could you speak maybe a bit to that?
Yeah, of course. Of course, we have the baseline end line throughout the cycles with the girls. So this is the basic tool that we use, the baseline and the end line with the girls and the boys, as well as their caregivers. And they, like in most of the assessment, there were increase in knowledge to all of them. As for the assessment, we did it when we revised the package. We did it with the beneficiaries as well as with our facilitators who are delivering the I'm Here approach. And of course, when we integrated the livelihood, it was based on the assessment that we did. When we integrated when we included the male caregivers for both vulnerabilities, it was after the assessments. So these kind of ideas, but in some areas, to be honest, like there was a fatigue from like the themes that are being there, because since the beginning of the crisis, when we like at the beginning of when I say the crisis, because maybe some of you don't know, when back in 2011, when we have the Syrian crisis, uh, the same vulnerability, both vulnerabilities are still the same, and they are increasing with the time. They are not decreasing. So also based on our assessment, the need now is, of course, the I'm Here approach is very important, especially that it's tailored and designed by the girls themselves. But also it's what is very needed is to shift is to work on the harmful social norms, because child labor and early marriage, part of it is social norms. It's not like only the economic situation or and so on. So it's very important also to work on changing to tackle these social harmful norms through other integration of other programs, of course.
Thank you. And we have now some questions in the Q&A, 2 questions, which is great. The first is for Amy. If you could tell us briefly something about the adolescent consultation tools. You mentioned them in your presentation, maybe just a bit more on how they were developed, and are they accessible for other organizations to use, and just a bit more. You're muted.
I know I said I would love to tell you more, except I'm on mute. So the Adolescent Consultation tool, a team at Mercy Corps, we evolved it from an original tool that was used and developed by the Nike Foundation through Girl Effect University. And like I mentioned, the idea is that if we have just one meeting with these adolescents, and this is their only interaction with our or with any NGO, that we want it to be enriching and not just extractive. And I had showed you photos from Colombia, in which the adolescents who participated really felt like it was a safe space, and they came back to our office the next day asking when the next activity would be, and how they could get together with their new friends. And so I'm happy to share. Yes, I would be happy to share with anyone who's interested. But generally, it's 90 minutes to 2 hours, and we want adolescent girls to feel that they have a voice, not just in programming, but in their community and with their peers. We want them to have an opportunity to make new friends if they're in a new community as a refugee, or bring a friend with them and share new learning. We try to, in that short amount of time, have girls recognize that they do have a voice, that they do have leadership skills. We have them interview a friend, introduce their friend to the group. We have them envision what they want their lives to be like in 5 years. And, based on the evidence and research, we know that if girls and boys can set goals, they feel more positive about the future. So we want that to be part of the meeting, but also we use that to then inform programming. What are these young people's goals? What do they want to achieve? And then integrating the asset building exercise from Pop Council. What skills and knowledge do they identify as needed to reach their goals? I showed you a drawing. We always start then after introductions with a drawing. So they're projecting their ideas and even risks or sensitive topics onto this friend or persona that they've created, because again, it creates a safer environment for sharing. I am more than happy to share with everyone the tool, and then we also have a guide for how to analyze some of that data collected in this more interactive format.
Thank you for that, Amy, and that would be great. Yeah, I think the question came from a colleague at Partners in Health and Development in Bangladesh we're working with right now to implement the approach. And so we're trying to find ideas as well as to how to better engage adolescents beyond the PRM exercise, because it does have some limitations. And PhD had other ideas as well for activities that they could do with adolescents, which were really helpful. So would be great to see those. And there's one more question from someone specifically for Sarah about the cash transition cash. And if you, Sarah, could speak maybe very quickly to any risks that you identified and how many disbursements were made and what did you find if the cash transfers stopped?
Yeah. Sorry, my connection wasn't that great. Sorry, so thank you for your question, but as I mentioned before, it's still a pilot. We didn't, it's a design, especially not the protection side, but for the livelihood, it's still in design phase and it's still a pilot. So we didn't, we will go in depth through time. So, thanks.
Thank you. We only have 1 minute left. I did want to ask a question about the environment that we're all working in now with COVID-19 pandemic, but maybe I can just hand it to Andrew quickly just for one last Q&A response as to how, if at all, you've been able to utilize the I'm Here tools or anything other learnings that you have from the I'm Here approach to adjust programming in any way in light of the COVID-19 pandemic, or any other, in the case of Northeast Nigeria, security concerns or security risks that might be presenting in the different field sites. You're muted, so if you could unmute.
Sorry about that. Sorry, the COVID-19, it's really an interesting one, which we've actually been trying to adjust to the new normal. For us to actually maintain the social physical distancing, what we were able to, this is not directly on the ISINC program because during the ISINC program, it actually ended in 2019, but I actually supported another EU-funded programs that is actually working. So they actually requested for my support, but again, we went through their database and see how we could segregate again to reduce the number of participants in safe spaces. We didn't have that leverage to make use of technologies, where we could like project or maybe share using technologies for them to actually look through their sessions, to reduce the number of contacts within a safe space. So what I was able to support them to do was still reanalyze the data, reduce the number. So for example, you had 10 to 14 years of adolescents that are actually within a safe space. We went ahead to disaggregated the age from 10 to 12. So within those, you see like maybe 5 persons participating in the safe space, though it is more work for those facilitating the safe space because you need to facilitate for different categories of age groups. So these were the adaptations that we made for those programs. Yeah.
Thank you.
And again, so again, the challenges still remain security because these things are really unpredictable. If you really look at the trend within this part of the country, you would realize that this is the time that the AOG attacks is usually on the increase. kidnapping on the rise. And again, the economic situation of the country is really something again that we are really looking at, but that's on a different level anyway. So the fear, the risk, and all of that, it's really not in support of programming in Northeast Nigeria. So we're actually looking at where these youths are actually saying it's safe. And again, with the support of the parents, if they could really consent that that place is actually safe, then we roll it out and it becomes a safe space for them. Yeah. Thank you.
Thank you for that. I would love to keep going with this discussion, but we are at time. And so I wanted to wrap up by thanking you all. This was really great to hear from each of you about the different experiences in implementing the I'm Here approach and how you've taken the approach, taken parts of it, contextualized it, and also built it out to be a bigger, greater than the sum of its parts. I think that is the spirit behind the I'm Here approach, is that it's not a prescriptive programming tool, but instead it's meant to be adapted and contextualized. And it's been great to hear how you've been able to do that. And thank you to all our attendees who've stuck with us a bit over. And we hope that people can join for the third webinar in our series, which will be the second week of December. We will be sending out registration link invitations soon. And that webinar will focus on the context of Cox's Bazar with our colleagues from PhD and other organizations working to reach adolescents in that context. And so we're really excited to go deep into that, into their experience and understand the different challenges and how PhD and other organizations have overcome challenges in reaching adolescents in what can be a somewhat restrictive environment for young people. Thank you again, everyone. Wishing you all a good day, a nice Thanksgiving holiday if you celebrate it, and to everyone else, a good week. And thank you. Bye.
Thank you.
Thank you.
Bye.
Bye.